Hi, everyone. My name is Dr. Andrew Bergmann, and I'm excited to share a research project that was conducted at the University of Rochester's Eastman Institute for Oral Health. I'd like to start off by briefly thanking my research mentors, Dr. Carol Erkely and Dr. Konstantinos Chokoladakis, for their guidance and support through that entire process. This was a clinical observational study where we assessed soft tissue thickness in completely edentulous subjects using a dedicated ultrasonic gingival scanner. If I may, I'd like to briefly review some background information. With dentate patients, we can either classify them as having a thick or a thin phenotype. As is with the image on the right, thick phenotypes often present with a flat soft tissue profile with larger amounts of attached gingiva, while thin phenotypes typically present as highly scalloped with minimal amounts of attached gingiva. And as we can see here, partially edentulous patients, as well as completely edentulous patients, can also present with thick and thin phenotypes. So how do we measure soft tissue thickness? Well, we can really break it down into two overarching categories with either direct techniques or indirect techniques. For direct techniques, we have bone sounding. However, for indirect techniques, we have computed tomography, optical coherence tomography, magnetic resonance imaging, and lastly, ultrasonography, which was the methodology used in this study. As we can see here, the aim of the study was to determine and compare alveolar ridge mucosa thickness at crestal, buccal, and lingual locations of the maxillary and mandibular arches in completely edentulous patients using a dedicated ultrasonic gingival scanner. 38 completely edentulous subjects were included in the study. And in each subject, soft tissue thickness was measured at 28 sites, excluding third molars, along the edentulous ridges. Measurements were required of the edentulous ridge at buccal, crestal, and lingual locations. Of the 3,192 sites measured, tissue thickness ranged from 0.96 millimeters to 1.98 millimeters, with a mean tissue thickness of 1.63 millimeters. No differences for soft tissue thickness were found in the mandibular arch, as well as at 4 sites in the maxilla, which were sites 2, 6, 12, 15. For all other sites, however, significant differences in mucosal thickness were found to exist. The effects of race on soft tissue thickness was also assessed. 4 sites in total, 2 in the maxilla and 2 in the mandible, showed that black individuals demonstrated a greater mucosal thickness than whites. The impact of age was also looked at. Age was correlated with increasing soft tissue thickness at 3 maxillary sites, as well as at 1 mandibular site. And lastly, in regards to gender, female gender was positively correlated with an increase in soft tissue thickness at 2 sites. Those were sites 2 and 4. So in conclusion, what can we really determine from the study? We found that significant differences for alveolar mucosa tissue thickness were noted at several sites of the maxilla. Tissue thickness differences were also noted for race, with black individuals showing greater tissue thickness than white, and age and gender did not show a clear effect on soft tissue thickness. Thank you for your attention, and I look forward to seeing you at this year's meeting.